let's talk about treating a cut. So if it's a small cut, then you don't need to worry about it too much because you just throw a Band-Aid on there, clean it out, you're fine, right? But if it's something a little bit deeper, you're going to have to do a little bit more work here. So let's go ahead and cut my hand with a Sharpie. All right, so I got a cut there on the back of my hand. Now I'm bleeding pretty good. I'm going to go over to the first aid kit and I'm going to go get myself some gauze. And I'm going to go ahead and apply pressure. I'm going to hold that on the wound for a few minutes here. I'm going to try to get that bleeding to slow down. Okay. Now, if the bleeding slows down, stops, we're good. I can put some antibiotic ointment on there. Maybe throw a couple of Band-Aids on there. I'm good to go. All right. But if it's still bleeding a little bit, it's pretty good, a little bit meaty in there. I'm not 100% sure if I need stitches or not. We're going to have to do a little bit more work. Now, if you've gone 20 minutes, the bleeding hasn't stopped, still going pretty good, and you can't get it to stop, there's a pretty good chance you're going to need stitches. But if you haven't reached that mark, and it's kind of stopping, kind of starting, but you can see some meat in there, we have what we need to treat it, okay? So what you're going to want to do first is you're going to want to clean the wound. So what we're going to do is I've got some hydrogen peroxide here, and we're going to irrigate that wound. We're going to clean it out the best we can, make sure there's nothing foreign inside of there, kind of look at it, make sure that, there's not metal shavings or dirt or anything like that, because that would cause infection. So we're just going to wash that off until it looks real good. Kind of flush that blood out, flush some of that stuff out. If it is bleeding, that's good because that's going to help push anything that might be in there out. And you also know if you have another cut on your hand somewhere, because I can feel it stinging right now for some reason. And you're going to go ahead and kind of pat that dry. Now, once you've got it good and dried off, you're going to want to take some of your antibiotic ointment. You're going to apply that antibiotic ointment to the wound itself, and then get that spread out in there. That also is going to try to help control the bleeding, as it's kind of the same idea as putting Vaseline on your face during a boxing match or something like that, where you got some bleeding that helps kind of stop it up a little bit. All right, so we put our triple antibiotic ointment on there. Now we're going to use some closure strips. These ones are the generic brand Steri-Strips, whatever it might be, but it helps hold the wound together. Now this is best to do with a buddy, because if you're bleeding real good, you're going to make one heck of a mess here. So we're just going to do one for general purposes here. But I'm going to take that Steri-Strip, I'm going to apply it, and then kind of pull the wound together a little bit, and then set it in place there. And I'll put as many of those on there that I need to hold the wound closed. Now, I'm probably still bleeding at this point. Maybe not terribly, but I'm probably still bleeding. So I'm going to take some gauze, and I'm going to put direct pressure on top of the wound. Now notice how I folded the gauze here. That's to put more pressure, because you're going to put a second piece of gauze over the top of that as an additional layer to help put pressure on there. Okay? Pressure is key to stopping the bleeding. Now I'm going to take a bandage. You can use the adhesive tape inside of your first aid kit. I'm looking at different first aid kits right now. Try to find something better that's going to more effectively treat some of the more serious cuts and back and muscular skeletal type kind of things. But anyways, I'm going to wrap that around there, make sure it stays in place. I'm going to make sure that I cover the edges of my dressing, both top and bottom. And I want it tight, but not so tight that I cut off the circulation to my hand. Now, a good way to check to make sure I haven't cut off the circulation completely, first thing is if my fingers start turning blue, that's a pretty good indication I've done a not very good job on that. Next thing I can do is I can check the nail beds. So if I push down, turns white, color comes back into them, we're good, right? So I'm good there, right? Now, I can go back to work like this. Throw a glove back on there, I'm all right, okay? You're going to want to make sure you change this dressing out, and then, of course, as it heals, you can use bandages or smaller, or Band-Aids or smaller dressings as it goes. But, you know, if it's a pretty good cut, you're going to want to do your best to cover it up real good, put some pressure on there, wash it out, put on your antiseptic, and then, you know, use those closure strips, put pressure on there, wrap it up, and you should be good to go.